Hello, and welcome to our series Brilliant Connections to Advance Performance Management. Today we're going to be talking about PSOs, patient safety organizations, their characteristics, advantages, and the basis for their emergence on the healthcare scene. I'm Julie Cerise. I'm the Senior Vice President of Performance Management at Vizient and your moderator. Before we begin our discussion today, we're going to show a short video that introduces this series and the various performance management programs we will be highlighting. So let's take a look.
There's a lot of opportunity in our member facilities to improve patient outcomes. So NPI Collaborative starts by having an executive sponsor for the program, which is typically the Chief Quality Officer and the Director of Quality Improvement. And now they would sponsor the program. But when you get into an individual project, we want to make sure that we've engaged the leaders in the area as well as the clinicians at the bedside in each of the projects. They could do either a self-service model where they would go to our website and select from a variety of those 20 topic areas. We have templates, tools, and resources that they could use on their timeline to make improvements, or they could join one of our collaboratives. And for 2015, we were able to validate over 9,500 patient harm events reduced in our cohort of members who participate in this work.
I lead a team of performance improvement advisors. They're a group of master's prepared nurses, pharmacists, engineers, and their sole purpose is to partner with you and help you meet your performance goals. We've got your data, we've worked with you for years, we know where you are strong from a PI standpoint and where you have opportunities. We also know how you have engaged with Vizient, the resources that are available to you. So we learn as much as we can, and then we want to have a conversation to understand your priorities. We're going to look at your data and we're going to see, is there a comparison, is there a gap between what we see as your priorities in your data and what you're focused on? But we want to make sure that you are focused on the things that really matter for you.
Our philosophy is really to address and provide for nurses at any point in their career path. So we're working with those newly practicing nurses and the coordinators of those programs, directors of education. We're working with nurses that are advanced practice nurses in the provider role. We're working with chief nursing executives across the country in geographic networks with the academic medical centers. And I would just emphasize we have a real focus on the interprofessional team. So we're not just working with, for instance, a CNO, but it's the CMO, it's the CQO. It's really that whole triad, so clinical and operational.
So the Accreditation Advisory Services offers a continuous accreditation compliance service. We're identifying best practices, what works, and we see what didn't work, because we do see the challenges organizations are going through, both through a CMS survey as well as a Joint Commission survey, HFAP, whomever that accrediting organization might be. So we can actually walk through that minefield with the organizations and help them to do things right the first time, which is one of the greatest benefits. But we do give them options when we're talking to them about potential solutions. We give them more than one observation of success stories. So here's different ways in which you can actually meet the regulation, and then you can evaluate what works best in your organization.
The regulations have been set up so that organizations can comfortably and confidently meet the basic needs of the patient. We have a team that reviews, reads, and tracks the regulations, the news that's coming out from the President's office, and we boil that down and put it into a format, into real-time regulatory updates that the accreditation professionals and operational managers in our healthcare organizations can use. We have a track of webinars that are geared toward the fundamental topics. We also have an advanced series that focuses in on those topics that have proven problematic. We don't wait for members to ask us what's changed. We're already looking to see what's new in the regulations, what's changing, what's on the horizon, and we're delivering that information to them before they've even thought about it.
Vizient is a patient safety organization. That is an organization listed by the Agency of Healthcare Quality Research. And the purpose of the organization is to conduct patient safety activities. So we help the members create in their environment a safe, protected place where healthcare providers can learn from medical errors, events that they report to a PSO. We also connect them with other providers so that every healthcare provider doesn't need to experience the same event. They can learn from others and proactively improve patient safety.
So that video highlighted in a broad way our portfolio of performance management offerings, and we're going to cover those in more detail during the course of this series. But today we're going to focus on one of the areas featured in the video, the Vizient PSO. And we're going to examine how can it help you deliver the best and safest possible care for your patients. You're going to see how you can improve patient safety by comparing your performance with your peers, by identifying potential problem areas, designing processes for improvement, and then measuring results. You'll find information on this topic in an educational supplement posted on our website, so please refer to this resource to see the slides from today's program and additional content that you're going to be able to download at your convenience. We want to let you know you're an important part of this program, and we want to hear from you. And there's several ways you can join us. You can chat with us online. So if you're watching on the web, send us your questions or comments at any time. And just type your message and click submit. Great news, we have questions already. And you can also email us at vizientvideo@vizientinc.com. So whatever's easiest, we'd love for you to join the discussion. So now let's meet our special guest, Ellen Flynn. Ellen, please tell us a little bit about the role you play at Vizient PSO.
Thanks, Julie. I'm the Associate Vice President of the Safety and Accreditation Programs at Vizient. I have responsibility for Vizient's patient safety program, which includes the patient safety software and PSO.
So thank you, Ellen. We're so glad to have you here, and let's begin our discussion and take a look at the history behind PSOs. So tell us more about what the government has done to mandate action for patient safety.
Thanks, Julie, and I'm thrilled to talk about it. The Patient Safety and Quality Improvement Act came about in response to the Institute of Medicine's To Err Is Human report back in 1999. It was actually signed into law in July 2005. And what it did is it established a system of PSOs, the National Patient Safety Database, privilege and confidentiality protections for healthcare providers that submitted patient safety work product to a PSO. But really, when I read the act for the very first time, I thought, the government really gets it. They really understand that healthcare providers need a safe, just culture in their environment to learn and grow and solve medical errors. The government's goal was to improve patient safety by encouraging voluntary and confidential reporting of events. That's both actual events and near-miss events. The final rule implementing the act was released in November 2008, and what that did is it authorized the creation of PSOs, outlined privilege and confidentiality protections for submitting data to a PSO to improve quality, safety, and healthcare outcomes. The rule took effect in 2009. And now, in 2014, CMS issued the final rule associated with the ACA. Essentially, what this rule says is that as of January 2017, any healthcare provider that has more than 50 beds must use a patient safety evaluation system if they want to participate with the healthcare exchanges. The rule was updated in 2016. It requires a PSO contract. They made a couple exceptions if organizations participate with the Health Engagement Network or the QIOs. But remember, there's real advantages to participating with the PSO. It's the privilege and confidentiality protections associated. That's the only program that has this. And it helps support this just learning environment within your organization. The HEN project also, I just want to warn organizations, funding is only promised up to October 2016. After that, it's unclear.
So Ellen, you've given us a ton of information about the directives and the mandates from the government, but we do know that there are some specifics that you want to tell us about, some definitions that'll help frame this discussion as we go forward.
Totally agree, Julie. This Patient Safety Act created a whole new language for healthcare providers. There's terms that you need to understand. They're simple, and just want to go through a few of them. I talked about PSOs, or Patient Safety Organizations. So what is that? It's an entity that filled out a certification listed by AHRQ. And basically, that entity promised to carry out patient safety activities. And those patient safety activities are working with providers of which it has contracts to improve quality, safety, and healthcare outcomes. So who are the providers covered under this act? They're licensed healthcare providers. They're individual providers, physicians, nurses, physical therapists, and entities, hospitals, nursing homes. And what a great point extra is, this act covers their parent organizations, because we know more and more organizations are joining healthcare systems. And as those organizations band together, corporate patient safety activities are covered under this act. Then there's the patient safety evaluation system, and this is a confusing concept. You can see the definition up there. My simple way of thinking about it is the who, what, when, where, how we conduct patient safety activities in our healthcare organizations. Patient safety work product. Again, a term that gets confused all the time. So what is patient safety work product and what isn't it? Patient safety work product is not factual information. So a medical event happens. The event should be documented in the medical record. Those facts are not patient safety work product. On the other hand, a patient safety event report gets submitted, and that describes why did the event occur, how could the event be prevented, what were the contributing factors. All that subjective, judgmental information that healthcare providers are submitting to improve care, that's all patient safety work product. Plus the deliberations and analysis conducted within the provider's patient safety evaluation system. So common format. Common format is just a standardized way that AHRQ has identified for healthcare providers to report patient safety events. There's different common formats for different healthcare providers, hospitals, nursing home, but it really provides for meaningful comparison across like providers. And then finally, there's the National Patient Safety Database. Essentially, this is to support on a national level learning about medical error so that the government can help us all improve care with action-based, improvement-oriented initiatives.
So Ellen, that is incredibly helpful information. It's going to really help us frame this discussion. But let's go back to the Act itself for a minute. So what kind of environment was the Act trying to create?
The Act was really trying to create this safe, just, accountable culture in organizations, a learning environment. I mean, anybody who's been around healthcare for any period of time knows that there were problems about events. There were, people were afraid to report events. Why? They could be punished, the data could be used against them in litigation. There's probably the old joke about burying errors. It occurred, and now we have a great opportunity. We have an opportunity to learn from those errors as opposed to hiding errors. Caregivers were disciplined when they reported errors. And as far as state laws, there was limited in some states or no peer review protections available. Another important part to remember about the history of medical errors and events, not all providers are treated the same under all state laws. Physicians usually are protected in most states, not all, but providers like nurses, physical therapists, it depends on your state. This encourages a safe space for learning. Plus, providers cannot be disciplined when they submit data to a PSO in good faith.
So tell us a little bit about some of the desired outcomes from this Act.
Well, by removing fear, it increases reporting within the organization, so the organization knows what's really happening internally. It allows for the early recognition of opportunities for improvement, both at the local level, because now events are actually being admitted, reported, and then when they get aggregated at a PSO, you don't have to wait for 5 events to occur in one healthcare organization. You can learn from the aggregation of events across healthcare organizations, and we can help our members implement solutions. And our job is really to do the work that every individual organization doesn't have time to analyze the data, identify how we can spread best practices across organizations, use the evidence in the literature to really improve patient outcomes.
You know, Ellen, several times you mentioned protection. Can you spend a little bit more time telling us about how far the Patient Safety Act goes to providing protection to organizations that share this kind of very valuable information?
Julie, thank you. I would love to talk about that. The Patient Safety Act privilege and confidentiality protections prevail over any state law protections. A couple things to remember about it. It's consistent, same level of protection for all providers. There's limited disclosure exceptions. It applies in both state and federal court, which state law protections don't. And it can't be accidentally waived, which many state laws can be.
So go over the major benefits created by the Act. What would you synthesize those to be?
I think the number one major benefit is this creation of a safe, just learning environment in healthcare organizations. I can tell you so many times physicians say that peer reviews a paper activity, it's not a learning activity. If healthcare providers want to take advantage, they can go into this safe space and give each other confidential, really direct feedback on their performance and how they think they can improve it. Privilege and confidentiality protections. And as mentioned before, earlier recognition both internally and externally of failure patterns. And support and development of strategies to eliminate patient safety and risks and hazards by the PSO, and meaningful comparison across similar providers, which all healthcare providers are interested in.
Ellen, a lot of great information about the Act, but now I think what we should do is switch gears a little bit, and let's talk about the PSO itself. So Vizient is a PSO, but let's talk about what are the obligations as a PSO. What does the government expect us to do as a PSO organization?
Great question, Julie. Each PSO must certify every 3 years that we're conducting all of the patient safety activities outlined in the Patient Safety Act. And for Vizient, it's easy. We do these things all the time. It's efforts to improve patient safety, healthcare quality, and outcomes. It's collection and analysis of patient safety work product. It's development and dissemination of information to improve patient safety in our healthcare members, recommendations, protocols, information regarding best practice. It's using the patient safety work product to create a culture of safety in the members' organization and learning from that patient safety work product to help the member reduce risk in their organization. We have to meet requirements very similar to the requirements of HIPAA. Related to security, there's a couple extra requirements in that the provider is protected and the reporter is protected, so named providers and reporters. We have to maintain the confidentiality of the patient safety work product because it really is important to those providers who are willing to expose themselves to identify ways to work with their organization to improve care. We need to utilize qualified staff, which we definitely do at Vizient, and we have to conduct patient safety evaluation system operations, including giving direct feedback within our patient safety evaluation systems to our members.
So Vizient is a PSO, and we'd love to learn a little bit more about how that originated, what has been its history to date.
Vizient, I would actually call a pioneer in patient safety. In 2002, Vizient established one of the first event reporting systems. I'm really excited about that because I've been lucky enough to be involved with Vizient since 2002 and see the event reporting system we developed back then to what it is today. We were one of the first PSOs listed by ARC. We're actually PSO number 7. our healthcare workforce is very credible. We have licensed healthcare professionals. They're all certified patient safety professionals by the National Patient Safety Organization. We have a national presence and thought leadership in patient safety across 50 organizations and 26 states. We are a leader in peer review publications and presentations. I'll give you an example. Next week is the NPSF annual meeting. We're presenting a poster there. The poster is about air embolism. And people will think, well, how often does air embolism happen? But we've developed an action-oriented recommendations related to activities that have to happen every day, every time to prevent air embolisms in our patients. We have recommendations for central line insertion, central line maintenance, and central line removal. They're critical to preventing air embolism, and we're really excited to not share that just with our membership, but to share it with the nation to really support patient safety. We have a common, easy-to-use format. We have access to comparative reports to benchmark performance with like organizations. I'd like to say one thing that I'm really excited about now with Vizient's PSO. Early on, our members were joining just for the privilege and confidentiality protections. Just a couple weeks ago at our joint networks meeting, a member said to me, we have great state law protections, and actually in the state this member was in, they do have great state law protections. She said, I see now though, I need to join for the collaborative opportunities. I need to network with my peers to accelerate the pace of patient safety improvement in my organization. And that's what Vizient is great about. We've been doing that before we were a PSO.
So Vizient has an incredibly long history as a patient safety organization, which is really wonderful. Tell us a little bit more about the member experience today. So if I were to join the PSO, what would be my member experience? What would that look like?
So initially, meet the standards. If you join our PSO, we're listed by ARC. Members will meet the ACA requirements. In addition, they'll gain the federal discovery protections. But what I'm really excited about is they're going to get this opportunity to collaborate with their peers and improve their patient safety outcomes. We do this in a variety of ways. We have user group meetings where they help give us direction on what kind of studies we should do. We have safe table meetings. We create a safe, secure space where they can talk about patient safety events in their environment, what the contributing factors were, and then what worked and didn't work when they were trying to prevent the events internally and learn from each other. And then we offer our PSO officers education on improving the culture in their organization.
So Ellen, you've mentioned a couple of times the qualifications of the need for high levels of qualifications and credibility amongst the staff. So spend a little time talking about your staff.
I am so lucky. I have such a wonderful patient safety organization workforce. They're licensed healthcare professionals with over 30 years combined experience working with academic medical centers, large complex health systems. Together, they have over 16 years combined experience of facilitating providers' PSO participation and PSO operations. Doesn't sound like a lot of time, but remember, PSOs have only been around for about 8 years. They're certified professionals in patient safety by NPSF. And then we have these skills that we have within our PSO workforce, and we can tap into the broader Vizient team. Evidence-based research skills, statistical analysis skills, complex data management. And again, I want to say it's not just our workforce. When you join Vizient PSO, you're joining a PSO that's a part of a bigger organization. We're just a small component. We tap into for improvement opportunities, Vizient and our membership throughout the country. In addition, we work all the time with leading subject matter experts, such as Mike Callahan, who's probably one of the leading attorneys in the PSO field.
Sounds like you've got a great team. Incredible. So tell us a little bit more about how you would join a PSO. I'm sure people who are listening today are saying, well, how would I get involved?
So to join the Vizient PSO, you need to sign a contract with us. And participation is flexible. The Patient Safety Act says that. Providers can choose how they want to work with the PSO and what services they purchase from a PSO. You're not required to work with our PSO to purchase any event reporting system. We can take data from all event reporting systems. We do have a patient safety software solution that makes it easier for members to communicate with us.
So tell us a little bit more about what the individual organization would experience by their participation.
So the individual organization is going to experience opportunities to collaborate with their peers. We're going to bring them together in meetings to develop action-oriented tools to address patient safety issues. We are going to bring them together in those safe table groups we do. We plan educational opportunities all the time. We have a call because documenting your patient safety evaluation system is not an easy exercise. It needs to be done right. Legal teams need to be involved. We bring Mike Callahan, who I mentioned before, all the time to our monthly PSCS documentation calls to talk about questions members are experiencing as they're proceeding with documenting their PSCS. In addition, we have additional services. I like to think about a PSO as somewhat the National Transportation Safety Board. It's really hard to look at your data and see all the issues objectively that are going on internally. It's nice to bring in an outside objective party to look at what's going on and offer evidence-based recommendations. Just another set of eyes, but our set of eyes are staff who are healthcare professionals and certified in patient safety.
Ellen, when an organization joins the PSO, what are they obligating themselves to, or what are they committing themselves to?
So if you choose to submit patient safety work product to a PSO, you've got to maintain the integrity of the patient safety work product as outlined in the Act. You need to transmit patient safety work product in a secure manner. And we help our members figure out how to do that. We wouldn't accept data in any other manner. And then you need to ensure that they're meeting the documentation requirements outlined in the Act. Example of documentation requirement, there's an option to remove data before reporting it to the PSO to use for another purpose. If you do that, you need to maintain a log, you need to document the date of removal. We help our members find creative ways to make sure that they're doing that consistently. Patient safety evaluation system documentation is not required, but it's a best practice. And just a recommendation, if you want to defend the privilege and confidentiality protection, if it's ever challenged, the PSCS documentation is what's going to do it.
So you've mentioned several times privilege and confidentiality. Can you tell us a little bit more about how that data is protected on behalf of the participant?
Sure, I'd love to, Julie. Patient safety work product is privileged. It's not subject to subpoenas or court orders. Freedom of Information Act or other similar laws, requests from accrediting bodies or CMS. It's not admissible in any state, federal, or other legal proceedings, state licensure proceedings, hospital peer review disciplinary proceedings. There's limited exceptions. And as I said before, the key to maintaining this privilege and confidentiality protection is putting the time and effort into documentation of the patient safety evaluation system. And I'd like to say to all of you out there, think about now if you're not working with a PSO acting right away, because it probably takes about 6 months to truly get a contract in place with the right PSO and document your patient safety evaluation system. Documenting a patient safety evaluation system is not a task for one person of the organization, the safety director. It really requires the whole team, legal, safety, quality, risk management, medical leadership, and the PSO to set together, document it, and then educate staff on it. Vizient has actually developed a checklist to help our members through the process. It outlines each and every step you need to do to document your patient safety evaluation system. And we're going to hand that out with our handouts today.
So let's talk a little bit more about how data gets submitted to the PSO and then take it all the way through to the National Patient Safety Database?
Great question, Julie. We have a graphic that's you're looking at right now, and you'll see the big H. That's our providers who work with us. It's a hospital, it's a nursing home. You'll see the orange circle, that's the PSO, and you'll see bidirectional arrows. That really talks about the fact that the healthcare provider and the PSO are collaborating on improving patient safety outcomes in the organization. Providers send the data to the PSO conducts deliberation analysis and provides feedback on their findings and recommendations to improve care. You'll notice then there's an arrow to the PSO PPC. This is an independent third party that takes patient safety work product, and it's only if the members want to. Some of our members choose not to report data to the National Patient Safety Database, but if the member wants to, the data goes to the PSO PPC and is contextually de-identified and then forwarded on to the National Patient Safety Database in a de-identified manner. And all this data that I'm talking about communicating in this way is all being sent back and forth in a common format that allows for comparison of like organizations.
So earlier in our conversation, you talked about the patient safety evaluation system being the who, what, where, and how important it is for organizations to detail this. Can you tell us a little bit more about how they would go about doing that?
Oh, I'd love to, Julie. It's something we work with our members on all the time. First off, one of the first steps to working with the PSO is to establish your goals. And this is part of your PSCS documentation. What are you trying to achieve by working with the PSO? I'm hoping that very few healthcare organizations are only going after the privilege and confidentiality protections, that you really have some concrete goals related to patient safety outcomes, the culture of safety that you want to achieve by working with the PSO. Who's the workforce? Define who the workforce is going to be that operates within your patient safety evaluation system. Remember, that workforce has probably other roles outside of the organization, so you're going to have to modify their job descriptions to reflect what they're doing within the patient safety evaluation system and outside. Define the workspace, equipment. It's really important. In our patient safety evaluation system at Vizient, we've gotten very deliberate and specific, and I didn't think it would, but it adds value. We have actually a specific room where we go into to conduct patient safety evaluation systems, deliberation, and analysis. And I can tell you, when we go into that room, we don't think about anything but patient safety activities, and it really improves the outcome of our work. Then define how you're going to collect data. How are you going to conduct deliberation and analysis within your patient safety evaluation system? An important thing to remember as you're doing this, the Patient Safety Act is real clear. Organizations need to still meet their regulatory requirements. That's got to be done outside of PSO activities. So, you're going to have to say, we need to do this for regulatory, but we can do a deeper dive of this data to figure out why it happened, what the contributing factors are. And then you need to have a plan to communicate with the PSO. You need to revise your policies and procedures. And you need to, at least on an annual basis, evaluate the effectiveness of working with your PSO. Are you achieving the goals that you hope to achieve?
So Ellen, a few times you've mentioned data analysis, data collection, prioritization. So we know organizations have lots of data. So give us a better understanding of the process for categorizing and prioritizing the kind of data you would collect and report.
Love to. And Julie, this is such an important question. Probably one of the most disliked staff by healthcare providers, but again, you need to establish your goals, but then you really need to conduct a data inventory. I think you need to conduct a data inventory whether or not you're working with the PSO. I've done these when I've managed large quality and safety departments, and you'll find out that 3 people in the organization are all collecting essentially the same data, may have different goals, different little tweaks of the project, but there's a lot of duplication of efforts going on in our healthcare organizations, and we need to reduce that. The data inventory helps, but essentially you want to know what's the primary purpose for collecting this data? Who uses the data? Is it an allowed use within the PSO? And then really, how is this going to help you achieve your goals related to patient safety?
So we need to get into a little bit more detail about this concept of prioritizing. How would you suggest organizations prioritize their submission?
So this is kind of a fun question, and it's kind of fun to show you the grid that I'm going to put up. Our members really were struggling with prioritization, and we came up with this bubble chart. And it's going to be different for every healthcare organization. But if you look at the x-axis, it's the severity. So what would be the impact if this information became discoverable? And then the y-axis is what is the probability of this data being discoverable? The size of the bubble is how much data do we have out there. So I'll give you one example, corporate patient safety activity. I don't know of any state law that protects corporate patient safety activity, yet more and more health systems are being formed, and to meet their ethical obligations or mission, vision, and values, they need to be conducting corporate quality safety activities. So, and some of this data they're collecting could be very damaging. And the probability of it being discoverable is high. So probably one of my first priorities if I was running a large health system would be to get my corporate activities reported to the PSO.
So Ellen, tell us a little bit more about the kind of feedback that a participant would receive to gauge their progress or identify their opportunities for improvement. How would they go about that?
So this is something we've developed this year, and I'm so excited to be rolling this out. And this is our annual feedback report with comparative data. You'll see an example of the report up there. We can't show actual data, but we show them their data over time. We show how their data compares to other healthcare organizations, and then we provide improvement recommendations. So that's kind of the standard report we show. This year I'm really excited because at Vizient we've been doing focus studies and developing improvement toolkits, compendiums. And one of these we've been working on right now is the whole opioid issue. We know that that's a big issue in healthcare organizations. We did a deep dive into our patient safety work product to see if our members were having any issues. And we found 3 categories of issues. Opioid resource, we went to look at what reversal agents are being used by our members. And when we looked at the reversal agents, we saw that there were issues related to sedation, drug administration and monitoring, pain management, overdose and monitoring, and unauthorized controlled substance use. This was something we hadn't seen before in healthcare organizations. So we took all these resources that Vizient, the organization, is pulling together, and we're building that into our feedback reports because we know quality safety directors are so busy. They're focusing on so many different issues at one time. This may not be the top of their list, but on our feedback call, we're going to go to them and say, here's the issues we saw in your organization related to opioid use. And we've got evidence-based recommendations specifically for your organization that you want to look at. We saw this. Look at the resource on page 17. That may be very valuable for you. It gives the PSO and the provider an opportunity to pause, look at their patient safety work product, and develop an improvement plan. It helps both sides be able to find the gold and use it to improve outcomes.
So Ellen, let's just circle back real quickly on data and analytics. Tell us about the kinds of comparative data reports that you're providing.
So we actually at Vizient are fortunate enough to have a comparative analytic tool that we use within our PSO. There's challenges with it, and that's what I want to talk about because, as we talked about earlier, The Patient Safety Act allows for flexible participation models. So all of our members don't report all of our events. But they all want comparative data. So when we go and try to do that comparative data, we don't necessarily have an apples to apples comparison. So we put a lot of time and effort into planning our data collection projects. We're starting one right now on falls. And so we brought everybody together, said, we want to look at falls. Will everybody submit all their events? We actually brought Mike Callahan, the attorney, to one of our meetings to talk about a stipulation in the Act that allows to submit a copy to the PSO. So there are ways to submit all your data, and we wanted to make our members comfortable doing that. So at the end of the day, we could have a meaningful comparative analysis on falls.
So go on for us now and tell us a little bit more about the projects. You've referenced a few projects. Tell us what happens during the course of a year and what kind of projects are worked on.
So we're just wrapping up a project related to clinical alarm use. It's a huge topic in healthcare organizations, alarm fatigue. We actually presented that work at the ARC Patient Safety Organization annual meeting. We're starting on a project with patient falls and comparative data. Everybody's interested in that. We're convening safe tables to identify topics around health information technology and medication use. And then the opioid is something we just have to get on as soon as possible. I think everybody in the country is working on that right now.
Well, that was incredible to see the huge body of work that you have on these various topic areas, and great reference information going all the way back to 2012. So tell us a little bit more about the general patient safety organization activities. What other things are going on in your program?
Thanks, Julie. You'll see we have a calendar that we release to our members on a regular basis, and it has different types of events that we do each month. So typically each month we have priority topics that we're working on action-based toolkits with them, and the members prioritize those last year. We have ongoing training. We have what we call the monthly patient safety evaluation system documentation call. Members call into us, they say, I'm struggling, I want to submit this type of data to the PSO. Is it possible? Either if we can't get the answer from ourselves, from ARC, we'll bring in Mike Callahan or other experts to talk about it. We also are working with 2 key contacts at each PSO on helping build a knowledge base related to improving their culture of safety and outcomes in their organization. And then finally, the safe tables. Safe tables is really what Vizient has always done. We've always brought our members together. We've always talked about what's going on in your organization. How can we improve care? We've shared best practices, connected each other. Only difference now is that it's done in a safe, protected environment that won't be discovered.
Ellen, lots of information here. Thank you so much for giving that to us, but I'm sure this is on everyone's mind. How do you get started? How do you get this moving?
Very first thing for all of you is to define your PSO participation goals. I know I said that before, but you really want to be concrete and clear. What do I want to achieve through this? And then obtain executive board and legal guidance. You really want your leadership and legal team involved in this and supporting you all the way. You want to select a PSO that can help you achieve your organizational goals. And then, as I said, keep an eye on that January 2017 deadline.
So, thank you so much, Ellen. Before we go any further, though, we want to get you involved. We're ready for you to join the conversation, and there's a couple of ways you can do that. So join us through the chat online. If you're watching us on the web, just type in your question or comment and click submit, or email us at vizientvideo@vizientinc.com. So Ellen, in a nutshell, what do you think are the major benefits of the Vizient PSO?
I think the one most important benefit is that Vizient is passionate about patient safety. We truly want our members to have the tools to deliver the best and safest, respectful patient care in their organizations. We want their providers, your providers, to work in an environment that drives learning, innovation, and improvement. Same environment all of us would want to work in. Vizient PSO has an experienced, competent, and dedicated patient safety work product. We create opportunities for our members to network with peer health systems to accelerate patient safety improvements in our members. And this isn't something new to us. We've been doing this for years. And Vizient has access to actionable tools and evidence-based resources and experts across our internal and external team. You're not just joining one small PSO. You're joining a PSO that's a component organization that has a wealth of experts at its fingertips. Our team has been working with PSOs since 2008. We understand the legislation, and most importantly, we understand how to help our members use the legislation to improve their outcomes.
So thanks, Ellen. We do have several questions from the audience, and they're very interesting questions because they're questions about how to connect the dots with other things going on in your organization. So let's go to this one. How does a PSO relate to the patient safety domain in value-based purchasing? What are the connection points, if any?
Oh, I think that there's all kinds of connection points. It's the same information, but now you have a safe, protected space to look at the detailed data of why these events are happening, not the numbers you're counting and reporting to the government, but the why around it, and how can we improve these value-based purchasing outcomes.
So here's another question about connection as well. So what's the relationship with QIO activities the hospital may be engaged with and the PSO?
That's a really interesting question. So the QIO information is separate from the patient safety activities. The patient safety activities cannot be shared with the QIO and external bodies. On the other hand, the QIO information could be brought into your patient safety evaluation system, that copy option that I talked about. And what's really neat is that you can dig a little deeper, information you may not want to share with the PSO, to really get to what the true root cause contributing factors are from these events and develop improvement plans.
So Ellen, there's a couple of questions about participation or exemptions to participation. So let's go to this one. So if we're involved with the Vizient HEN, does that not mean we need to be part of the PSO?
Great question, Julie. We don't know. So funding for the HEN project hasn't been announced beyond October of 16. It's kind of putting all of you in a rough situation. You could wait to when the government makes an announcement and make a decision. My only concern for all of you is that you won't have the time to get a contract with a PSO, document your PSES, and start reporting to a patient safety organization. So, and the other thing I would really have organizations think about is that the HEN projects don't offer the privilege and confidentiality protections. And that's what you really need to create that safe learning space in your organization.
So I kind of hear you saying a couple of things. We do have some legislation that we're waiting for to understand whether or not we're going to have HEN programs that will go forward. But I also hear you saying that there's an opportunity, even if you're part of a HEN, to be part of a PSO, and there's value and benefits in that regard.
Absolutely, Julie. If I were a member, I would have both. I mean, and the information that you're submitting to the HEN project, I'd probably take some of that information within my patient safety evaluation system and conduct further deliberation and analysis on that data. Information that may be more sensitive, confidential.
So this is a great question. This is about joining a PSO. So once signed with a PSO, will the PSO staff that you have assist the organization through walking through the steps of the requirements? What kinds of advisory or assistance do you provide an organization to get up and going?
Great question. Actually, this is something we've put in place over the last 2 years. So every new PSO member in our organization has a one-on-one meeting with our PSO program manager where she provides an actual orientation to the PSO. Once we provide that orientation, then we get the member into our ongoing activities to document your PSES. We're available for telephone calls, but we really do guide our members through the process.
Here's another question. If I work with a different patient safety event reporting software, can I still join the Vizient PSO?
Absolutely. We're able to accept data from any reporting system. We have a file specification, and it's really pretty simple. Just about any reporting system could generate the data we need, and it can be sent to us in a secure manner.
That's great. That's fantastic. Another one about safe table activities. Can you go into a little bit more detail about what goes on during a safe table?
Sure, I would love to give you an example of one that we had this fall. The opportunity identified by our members was escalation of care. At our annual meeting in, I think it was October of last year, we brought our PSO members together and had a safe table. At the beginning of the meeting, we had all our members sign a confidentiality statement. We wanted them to know that we would be discussing information and that it was privileged and confidential, and they couldn't share it outside of this room. And then we had really meaningful information sharing across organizations on what kind of events have they experienced, what kind of actions have they taken, what actions worked, what actions didn't work, and really came up with some improvement recommendations.
That's great. So questions can continue to surface about enrollment and exceptions to enrollment. So I'm going to try to put this to you. So can you clarify who needs to enroll in a PSO and what the exemptions to enrollment are?
Sure. So any healthcare organization with more than 50 beds who wants to participate in the healthcare exchanges. The exemptions are HENS and QIO participation. And again, just remember what I mentioned as far as the funding for the HEN projects.
Right. And so the HEN activities are quality improvement activities as well as the QIO activities. Correct. And the PSO provides this safe space for talking about these events and understanding the whys and actually getting that protection. That's
exactly
what I heard you say.
Absolutely.
That's great. That's great. So let's talk about this 2017 date, okay? So, you know, we have a timeline here right now. We're expecting that the expectation is that organizations will have to participate by 2017. Could you tell us a little bit more about that date? And there's a question here about whether or not we think it's going to be delayed.
Oh, that's an interesting question. It's been delayed once. I highly doubt that it'll be delayed again, and that was somewhat the message I thought I heard at the ARC meeting of PSOs back in April, but I can't say for sure. I would tell organizations to prepare, start documenting your patient safety evaluation system and interviewing PSOs who can meet your goals. I can tell you, as far as being a PSO, we're very busy right now getting requests to learn more about our PSO and how to participate.
Great. There's a question here about the central database. So where is the central database located? Where does the data actually reside? I think this is a really good question.
So the National Patient Safety Database?
I think it's more about where does their data reside and how does it come to our PSO, our Vizient PSO.
Oh, okay. Can you put the graphic on as far as the data flow again?
No.
No? Okay. So the data's in the healthcare organization. In Vizient, we're a component organization. We have a secure space that only Vizient PSO staff have access to. So we have dedicated workforce who have all signed PSO confidentiality agreements. The data flows securely to us via an SFTP process. We accept the data, and the data is maintained securely within a space with very limited access by PSO workforce.
So Ellen, there's a last question, and I'm sure this is on everybody's mind. It's about the cost associated with working with Vizient as a PSO for a current member. And we may want to give some global information about how organizations would proceed to get that kind of information.
So reach out to your Vizient contacts. You can contact me directly. I would love to hear from any of you. And we will take information about the participation model that you want, your organization size, and give you pricing.
Okay. So here's another, it's a question and a thought. You know, last week, I think it was last week, there was an article published, right, about medical errors being the third leading cause of death. You know, a frightening statistic, really. And, you know, since PSOs have been around since 2008, what has been the impact of those organizations? How would you describe the impact that they've had in terms of helping to reduce errors?
Probably not the impact that we would like to have had, and I think that's why the government has made this January 2017 date for PSOs. Organizations early adopters have joined PSOs, and many organizations have joined PSOs, but really haven't set up the safe learning space in their organization, haven't started reporting to a PSO. You really need to take advantage of working with a PSO. I showed you the bidirectional arrows for working with our PSO. It really is an engagement with your PSO who understands you, helps you set up the patient safety evaluation system, create a culture of safety, identify your data with you, and really get you on a patient safety opportunity improvement plan. I think many organizations were really focused in the early days on the privilege and confidentiality protections, and I think it's changing. And I think this new report out is a great driver of the change.
Another question. If CMS comes into my organization and wants to see my patient safety work product, what should I do?
Should not disclose it to them. And everybody says, how can I do that? I don't want a CMS corrective action plan. There is data that you can show. Let's talk about medical errors. There's the facts of the medical errors. We've worked with our members so that if CMS comes into an organization, they can generate a limited report that's just the facts of the event. So if they say, I want to see all falls on May 5th, they can see Mary Smith fell on May 5th at 3 p.m. on the 3rd floor, and then they can go to the medical record. The other thing we encourage our members to share with CMS is the actions that they've taken. Actions taken can never be patient safety work product. Yeah, you know all those recommendations that you're taking, you're thinking about taking. That's all patient safety work product and probably not the best thing to share with CMS or other regulators.
So last question here. If I'm not signed up with a PSO by the targeted deadline, what's going to happen?
It's an interesting question. According to the rule, it appears that you may not be able to participate in the healthcare exchanges.
So more to come on that, I'm sure. So we are at the end of our program, and I want to thank Ellen Flynn today for joining us. I also want to thank you for joining us. And also a special thanks to those who we interviewed in our introductory video. So please don't forget to fill out your program evaluation. Doing so gives us great insight and helps us plan future programs. But most importantly, don't forget to join us on June 9th for our second program. We're going to have a member panel. They're going to be talking about the Vizient PSO experience, the value that it's brought to them, their teams, and their patients. Now from Vizient Video, I'm Julie Cerise, and thank you so much for watching us today.